What area or structure does this artery supply? Gabby here from Med School Bootcamp, and here we're looking at a dissection along the posterior aspects of the abdominal wall. So we've removed all of the abdominal organs except for the kidney. So here's the left kidney, here's the right kidney, and we could also see the associated adrenal glands. Now let's have a look at the vessels that are surrounding the kidneys. We can see towards the right here, this is going to be the inferior vena cava or the IVC, and we could also see traveling with the IVC is going to be the abdominal aorta. Now we know that the kidneys get their vascular supply and drainage from branches of the abdominal aorta as well as the IVC. So we can see here at the hilum of the kidney, we can see the renal vein that is eventually draining the blood from the kidneys back into the IVC. So there's the left renal vein. Here is going to be the right renal vein, again, both draining into the IVC. And then the renal arteries, right, will be branching off. We can see one over here. So the right renal artery over here will branch directly off of the aorta to go and supply blood to the right kidney. And then we could also see small portions of the left renal artery. It's fairly deep underneath this renal vein that will go and supply the left kidney. Now, depending on what side of the body you're on, whether you're right or left, you may see some different branching patterns that are coming from and to the renal veins. So if we have a look here, we can see one branch that is ascending from the pelvis and eventually draining into that left renal vein. Versus we can see on the right side, we can see the same vein is ascending from the pelvis, but draining directly into the IVC. So a couple of variations there in the draining pattern of this vein. Now this vein specifically is called the gonadal vein, and its name differs whether you're female or male. So if you're a female, it would be called the ovarian vein. If you're male, it would be called the testicular vein. So a couple different draining patterns there. Now, of course, running with these veins are going to be the arteries that go and supply the gonads. So we can see one vessel over here that is coming off of the abdominal aorta right over here, traveling with that gonadal vein. And we can see the second one, so the right side, is also coming off of that abdominal aorta and then eventually traveling and reaching that gonadal vein. So the gonadal arteries will follow the same branching pattern at the level of the abdominal aorta, but the draining patterns of the gonadal veins are slightly different, with the left one draining into the left renal vein and the right one draining directly into the IVC. So that being said, if the vessel that is tagged is going to be the gonadal artery, so the ovarian or the testicular artery, this artery will go ahead and supply the gonads. Let's go ahead and double check our answer, and the gonads are a correct answer.